Welcome students for your open elective for second semester. Course title is First Aid for All. Let's start with the content of this particular course. The first unit is about the first aid and its importance. In this unit, I will be giving a brief about the what are the first aid, what is its definition, and what are the goals and aims of the first aid. So this first unit, that is 1.1, will be having all the important details and all the goals and aims of the first aid, followed by the basic steps of first aid. So this is nothing but what all steps you need to do or provide in different situations. So summing up that, so we'll be taking care in the basic steps. That will be in 1.2. 1.3 is nothing but what are the instruments we are trying to put in the first aid. That is in first aid kits, what all things will be added up, which is given by the Red Cross Society. In 1.4, we will try to give you an demonstration and the exact explanation about the examinations of vital signs. Vital signs are in four types, so we will be briefing about all this aspect and giving you a demonstration as well as the video about how to do the examination on the vital signs. In this unit, that is unit number 2, it's a first aid in common emergencies. So it will start with the bleeding, bruises and cuts, which we can see in any kind of aspect like kitchens or in kind of works. So we can find all these aspects into first aid. So how to do the first aid on these particular emergencies. The second is in the form of RTA or the road traffic accidents and in fractures. So these are the very common incidents or the emergencies which can happen in day-to-day life, and we will just show you and give you the all the important aspects and with the demonstration how to give a first aid on these aspects. Next is 2.3. We will be dealing with the first aid in sprains and mechanical pain, which are very common aspects if you see in the sports. So in that way, how if we are having any ankle sprain, you twist an ankle, what kind of a first aid you can give it to those kind of victims, and the basics of CPR. So all we know is the chest compressions, mouth-to-mouth breathing. So I will be giving you a brief about how to give a CPR and how well we can revise all the aspect of it. So this is for the unit number 2. In unit number 3, it starts with the basic techniques which we give in the first aid, that are dressings, bandages and transport techniques. So dressings are nothing but how to apply those different type of dressings we have in the hospital or we usually carry with our first aid. So what are the different types and how to apply these dressings. This will be covered in 3.1. 3.2 is all about the bandages. Bandages, if you have a twist, if you want to do a compression of the areas which are having swellings, and how to give a bandage and what all the different bandages are available in the market. So we will be dealing with those aspects in 3.2. 3.3 is nothing but health transfer techniques. Transfer techniques, for example, if a person is having an accident, if you undergone an accident, and how you will transfer that particular victim from the car to the stretcher or from the stretcher to the bed. So all these things are being covered is if the person, if you're single or if you have multiple help over there. So how you can variation can be happen in the transfer technique will be dealt in this particular subunit. In 3.2 or 3.4 is nothing but the post evacuation technique, that is about how you will be finding a evacuation. Then when you try to take off a victim from a, for example, if it is an earthquake, if the construction collapse, whether you can able to do a shoulder pull or you can do an ankle pull. So these will be dealt in the 3.4. In Unit 4, you will be dealing with basic first aid techniques for various conditions. So here we will be giving mostly on the our nervous system, like about the concussion, any kind of hit on your head. So we will be basically looking forward to the areas related to our brain. Okay, so first a unit will just give you a very brief overview about the nervous system. In 4.2, we will then go for injuries related things like head injuries, any kind of a concussions or the fractures, and also the main thing is stroke. Okay, so these we will be dealing in unit 4.2. In unit 4.3, we will be giving a snake bite, insect bite, all kind of bite which we can see from an insect or some other animals or organisms. So we will be dealing in that if it is poisonous, what we can do at that particular situation. That will be dealing in 4.3. 4.4, which nothing but in a very emergency conditions like epilepsy and panic attacks. These are very common, and we will be giving you a brief about the first aid on during these particular conditions. So in this 4.4 is very it involves all the systems in our body. So we will be having a very various systems, including the various conditions as well. So all these 4 units we will be dealing with how you can give the first aid on different conditions, different emergencies, and the basic steps. So this whole unit of the first aids will give you a better idea about how to deal with the situation, how to take a charge, and what are things to be done in an appropriate way. Let's start with basic first aid. So here the learning outcomes from the first unit will be you will get to know what are the first aid, the definition of it, and and its importance as well, along with the what are the steps that we can take to give a basic or the first aid. First aid is nothing but it's a first assistance or the first treatment that you as a first aider will be giving to a patient or a casualty person or sick person during after an injury before any kind of a help is arrived. So these are the important that definition of the first aid. So as we know, even when we are having a cut in kitchen, we go and directly put some pressure over it so the bleeding stops. So these are the first 8 steps that we take before the arrival of any kind of a help from the professional care. Okay, so this is the introduction. So basically we try to give the aiding to this particular sick patients or persons or the victims before even transporting them to the hospitals or to any kind of a medical care to give them the basic needs and the treatment that is required. Let's go to the aims of first aid. So the aims of first aid, the first and foremost is to preserve the life. So preserving the life is very important aspect. So when you are trying to give the first aid to a victim, you are trying to save their life from any kind of worsen conditions or the situation. The second point is to prevent the worsening of one's medical condition. For example, if the patient is having or the victim is having any epileptic attack or a seizure, if you try to give a first aid, which I will be explaining in the next coming up sessions, so you will be helping them to worsening that particular condition because many complications can happen during that particular duration. So we will be helping to help prevent the worsening of that particular condition. The third point is to promote the recovery. It really depends upon the first line of treatment which we are giving to the patient or the victim. So you as a first aider, when you give the first and appropriate treatment to that particular victim, you are promoting for their recovery. So this is a very important point and the aim of the first aid. So next and the last one is to help to ensure that the victim is being safely transported from the area where that happened to the into any kind of a healthcare facility. So these are the 4 pointers which is important and which are the aims of first aid. Now next is the goals of first aid. So goals of first aids are nothing but we need to know what are the basic things that we as a first aider should look forward to. So first and foremost is to maintain the vital function. Vital functions are nothing but they are the important functions of the body. Okay, so first and foremost is to find A, B, C of the life. A is the airway, B is the breathing, and C is the circulation. They are the priority to see check to any kind of a victim. So for example, if it's a road accident, so we try to see whether they are breathing properly, whether their bodies are warm or cold. If it is cold, that means there is no circulation to that particular area. If it is warm, then the circulation is intact. Circulation is nothing but the blood flow. So the ABC is very important factor. Being as a first aider or as a healthcare professional or as a doctor, these 3 people try to check for these first ABC, airway, breathing, and circulation in any patient or victim at first. The next goal is to prevent further injuries from the or further injury or the deterioration. This is nothing but when we are trying to give any first aid, as I told in the previous slide, we are trying to prevent from worsening the condition. So we are trying not to get more, that particular victim will not deteriorate so much. So we have to give a first aid so that we can preserve their condition or we prevent the worsening of it. Then the third and it is an important point, even if it is in third point, but it is really important to make sure the victim is as comfortable as possible and as calm as possible, because during any kind of situation like this, the panic attacks will be more. The patient or victim will not be able to hear or listen to you. So we should make sure the victim listen to us so that they are comfortable, to make them as comfortable, calm as possible. So these are the important aspects. Otherwise, if you are aiding any kind of first aid to this victim, they may withdraw. So reassuring to the victim is very important. Let's start with the first aid of infographics. So there are three different stages given and three different situations with different areas of situation. Circumstances are different. The first and foremost is the animation where it's shown that the patient and the first aider, when the first aider realized that the patient is not or the victim is not able to breathe, or this airway is not clear, or the breathing is not clear and his pulses are also weaker. So what they used to do, they have start with the chest compression, the CPR. They have started with chest compression as well as mouth-to-mouth breathing. So these are the first aid in this particular situation where the ABC are not valid. It's not even, we are not getting a confirmatory results from the ABC. The next one is activity before the ambulance arriving. So these aspects where, for example, if the patient is conscious and he is able to understand your command and he's able to follow and able to cooperate, then we will be trying to go take the particular patient to the side and make them safer, check for any other bleeding and trying to stop it up. If it is a fracture case, as in this, we'll try to make the fracture stabilize. So these are the aspects which can be in any kind of a road accidents or any accidents which is outside, or we have to make sure first and foremost thing is to make the patient into a safer side, and the areas has to be secured as well. So these aspects we will try to see when before the arriving of the ambulance. Next is when the admissions happen. Admission, when the hospital admission happens, we will, if the patient is not able to breathe again, as the airway is not clear, breathing is not proper, and circulation is also compromised, then we will go for a defibrillator. As we say, as a shock therapy, we try to give them as a charge shocks to their heart. Okay, it can be charged from 200 to 50 to 300 depending upon the condition of the patient. Okay, so here when we try to give any kind of electric shock, they will try to interfere with the activities of the heart and we will get the deflation from there. Let's move to the importance of first aid. Why it is important and why it is very beneficial to give the first aid. First and foremost, as I mentioned in the previous slides as well, where we are giving a quick medical treatment where before the professional any assistance or medical professionals arrives. So these are the medical treatment on the appropriate treatment it should be before giving administrating to any kind of a victim. So these are the important aspect of the first important aspect of the first aid. Second one is to ensure whether we are again whether we are whatever we are administrating to the victim, whether it is right and appropriate methods or not. So that is also that's why the first aid classes or the first aid information is very important, so that we are ensuring that the victim is getting the right amount of medical treatment that it is needed for them. Third one is also is important, as if a victim has a knowledge of a first aid and he's conscious enough to give him a treatment, then it is a far benefit. For example, if he fell down somewhere and he had a cut, so first and foremost thing, if the bleeding is there, he will try to stop the bleeding by using any kind of a bandages or the gouge first to make the area clean. So these are also the benefit once you get to know about what are the first aid and how to administer it. And then it offers the people to know with the ability. That means if a patient or if the person knows how to give a first aid in the emergency situation, for example, any kind of a train wreck or the construction drops out. So there are multiple injuries can be we can administer there, or we can witness so many emergency situation with multiple casualties. At that time, it will be helping to the other people to follow this kind of a situation. Let's start with the basic steps in the first aid. So when any kind of emergency situation happens, so the first and foremost step that we have to take as an individual is to make the area safe. First, you see whether you are safe and the areas are safe, then we can move to the next steps. The next step is to evaluate the injured person's condition. Third is to seek help. Fourth is to give the first aid. So let's go into a details one by one. Step 1 is to make the area safe. That means your safety comes first, always. As you have maybe, if you have gone to a flight, the first and foremost thing that particular air hostess will state that when the oxygen levels are less, when the mask drops, wear your first and then save others. Correct? The same way, the safety of you and yourself comes at first, and then as a first aider, then you need to check for another dangers or threats that you can get from the traffic or electricity cable wires which is there on spread out in the area. Try to secure the area first and then seek help from the respective peoples, or if it is a police or the cops or any kind of emergency ambulances or any kind of firefighters that you want to call upon depending upon the situation's demand. So this is the way you need to secure. If for example, if it is a road traffic accident, so try to put a danger sign or any kind of a sign just to make sure the traffic has been settled down. People are cautious about the areas of where which the incident had happened. So these are the important steps how to make the particular area safer. As a general rule, we usually say that if a area, like if there's an accident happened, we should not move the injured person, because we may not know whether their head, neck, any other things are injured, and if any kind of movement or any kind of bad transfer technique can make their condition even worse. Because if you are wearing a seat belt and you have a very bad collision with, for example, maybe the truck or a divider. So what happens because of the collision, the movement of neck can be forward and backward, that can usually cause what we call in a medical term is a whiplash injury. Can be have an injury to the vertebral column. So, and during which when we are trying to take out the victim from the car and we are not securing their head and neck, then it can worsen the condition and patient can be, or the victim can be paralyzed from their head to toe, from below the neck. He can be paralyzed. So we have to be very much careful, and we should wait for the help to come, so that they are securing the particular neck with the help of C collar, and then they are transferring successfully to our stretchers and then to the medical facility. So this is the important rule that we need to make sure it is being followed. And whenever you are handling any cases where the bleeding and any kind of body fluids you are trying to get into touch with, make sure you are sanitized your hand, you are wearing your gloves for the protection, because we may not know if the patient is having any kind of a diseases or disorder, or like HIV AIDS, we don't know. So any kind of a body fluid, if it is coming in contact with our body, and we also have an open wound, then the blood transfusion, that blood to blood interaction can happen, and where we can also be risking our life on that. So make sure you are protecting yourself by wearing the gloves, or even to sanitize your hands, so that you are not making the other people's area septic or any kind of infection on that particular. Step 2. Here we have to evaluate the condition of the sick or the injured person. So once you have secured the area, now just evaluate the victim. Now we have to check whether the ABC is okay, whether these three important vital conditions are working fine. If not, then you need to, if he is not breathing, if his the heart rates are not working, then we have to give the techniques of CPR. If he is conscious enough, he is breathing okay, then we are relieved and we can transport him perfectly to the and wait for the ambulance and then transport him to the medical health facilities. If not, we have to give all the details to the ambulance or the hospital where we are trying to seek the help. We have to mention all the conditions, whichever you have evaluated, give it to the patient or give it to the police or the ambulance or whomever you are seeking at first, so that they come prepared. So this is how you will evaluate. First, as I told you, it is about the A, B and C: airway, breathing and circulation. So these three are important aspects. If these three are okay, then we will try to see their consciousness and how they are breathing, and whether there are any kind of injuries are happened to not. This is one end. The another end, if you see the ABCs are not there, if it is compromised, then we have a life-threatening situation. So we need to immediately start with CPR. This is a pictorial definition where you can see where are the two paramedics are evaluating and also trying to give him the help. So if you can see already the victim is having the mask, the breathing mask. So here maybe we can conclude that his airway or the breathing might have been compromised, hence they have been given by the air mask and the oxygen supply. And the one paramedic is checking for his heart rate, and the another one is taking care of his bleeding here. Okay, so this is how we are trying to give the help, evaluate, and then we will try to seek the help. Step 3, that is seeking a help. So once you have evaluated, now you know the condition and you know whom to call. For example, if there is a fire in the building, the people that you will be calling will be the ambulance and the firefighters or the fire people, so that they are extinguishing the fire and evacuating those people. So and even if the patients or the persons or the victims are been injured, we are directly taken to the ambulance. So ambulance also will come in handy after listening to your situation, which kind of help we are seeking for. So if you are alone, you will only have to evaluate and you will only make the decision whom to call. But if you have any kind of a bystander with that particular victim, you will be asking the bystander to make a call. Meanwhile, you will be evaluating and giving the necessary first aid that is required to be. In India, we usually go for a calling an emergency the ambulance for 108, and in abroad it is 1911. Once you are in call, what are the information that to be exchanged to the particular authority? First and foremost, where this particular thing happened, which is the location, or where is the address. You need to give all the location properly so that they can reach on time. The next thing, which telephone number or the mobile number you are calling from. So that is also an important aspect that the patient or the bystander or the first aid giver should be giving to the associate people or the seeking help, if the police or if it is an ambulance department or it's the hospital or it's to a firefighter area, fire station area. So you need to keep all the information here. What is the nature of problem, whether it is a car accident or it's a fire explosion or it's a explosion or it's a multiple casualties. Everything has to be informed so that they will come all prepared. How many people were injured, whether it's one, two or more than 10. What are the natures of injury? It's only if you are able to diagnose or you are able to know that okay, she might be having a fracture, he might be having a concussion. It's only when you know it. If you have no idea, it's okay, these steps can be excluded. What type of help you need? You need, if you're calling a room control office, so you are seeking a help for ambulance, you are trying if you are seeking a help for the firefighter, so you need to check or you need to tell them what all helps are needed for this particular situation, or any other extra information if you can pass through apart from this will be helpful for them. Step 4 is to provide the first aid. This is the simple formula to the first step to provide the first aid is to first tell the patient or the injured or the victim and reassure them. As I told you in the rules as well, we need to reassure, make them comfortable, help them out, and tell them how you are going to help them, because gaining the confidence of the victim is very, very important. And only if you are gain the confidence and you feel you are reassured him, then only the victim will allow you to help him up, fix him up. Okay, so that is the first and foremost. Well, maybe it looks very easy, but it is really important step. Next one is to listen to the patient or the victim. Show him the concern and kindness that you are there to help them out. Okay, and next one is the third and important point is to make him comfortable. Okay, tell him you should not be worried. We are here to help them out. If you can see the other people are there around, near and dear people or his family members are there, you can also ask them to do the encouragement there. And the last thing is you need to tell the patient how what has happened and how you are going to help them and how you are going to be an important part from where he has to be transported, he or she has to be transported from the areas of accident to the hospital. So these are the important aspects where we are trying to provide the first aid. So this was all, students. So being as a first aider is a very important aspect because you can reduce a lot of possibilities of worsening the condition when you are giving the first aid. You are trying to reduce the all the complications which can happen after the hospitalization. So you are the first person, if you are trying, if you know what are first aid and if you understand and how to aid them or give them all the basic requirements, if you keep a kit with you always, it will be very really helpful for the people who are maybe sudden fall or any kind of accidents or fractures. They will be, you will be the one helping, giving a helping hand, a healing hand for these people. Thank you so much. I hope this session was useful to you. Thank you so much.